Hi, my name is Olivia. I am the co-director of the Occupational Therapy Department at the Center for Connection and the co-director of the Center for Connection and Neurodiversity, which is part of the center in Pasadena. I want to thank you for reaching out. This video is meant for those who prefer audio, video, transcription, or a combination of all three. The following is information I provide to all families and potential clients reaching out for support. We are a neuro-affirming division. What does this mean? This means that we respect each client's individuality and do not seek to change or fix anyone's disability or neurodivergence. We are committed to continuing to educate ourselves by listening to the community we serve and educating others about our neuro-affirming practice. We're pretty proud of it. Before we begin treatment, we follow best practices and will want to conduct an OT assessment in order to identify your child's strengths and areas that might need more support. Our assessments focus on sensory processing as the foundation for behaviors and engagement with the world. Our evaluations may also include standardized and non-standardized assessments in the areas listed here: gross motor, fine motor, visual motor, perception and tracking, reflex integration, executive functioning, and of course, sensory processing, including interoception. Skills are scaffolded one on top of each other, so it is common for a family, a caretaker, or a school to be concerned about one skill, but as you can see by this pyramid here, we might discover that there are other foundational skills that are impacting. We also consider ourselves behavioral specialists and attempt to find the deep why behind behaviors. So if there are challenging behaviors that you are observing, let us know. We can support you. So you might ask, are there times when we do not need an OT assessment? And the answer is sometimes. If you have an assessment from an outside agency or a school district within the last year, we can use that assessment to establish a therapy plan and establish goals. If you have met with one of our OTs and between this conversation and collaboration, everyone has determined that an assessment is not necessary, then we can continue on with scheduling. But what about if you have a psychological or neuropsych assessment? This is a common question. We get this every time. We generally see these assessments as a broad look at person's overall skills. These practitioners do an amazing job at assessing and identifying areas that might need specialization or more in-depth evaluation. That's where we come in. So for instance, if you have a report that identifies fine motor skills as an area of challenge, we aim to determine, is it strength, coordination, motor planning, sensory processing, visual motor skills? You can see a lot goes into just putting pencil to paper or crayon to paper. While there is some overlap, a psych assessment does not take the place of an OT assessment. So, what is the process if you're ready for an OT assessment? Well, we'll send you a scheduling link to one of our therapists, and a parent intake will take place via Google Meet and will be approximately 60 minutes. Then we will schedule a school or community visit if it's needed or desired. Then we will schedule an in-person assessment. This can be anywhere from 60 to 90 minutes in length and will take place usually at our Doherty location. Lastly, once all of the information is gathered, your therapist will schedule a feedback session, again on Google Meet, and will be around 60 minutes or so. So once all these things are done with the evaluation, or if you already have an outside assessment within the last year, we can continue with scheduling. We work hard to accommodate your busy schedule as well as school and activity schedules. We do take into consideration the child's age, the demand of their day, and the optimal therapeutic window when scheduling. Funding and fees. So although it says it in or on our website, I like to tell people or remind them we do not take insurance. We can provide you a super bill, which is sort of like a insurance receipt, and you can submit it to your insurance if you have out of network benefits. We highly, highly recommend that you reach out to your insurance company, talk to them about your out of network benefits before you start therapy. We do take self-determination, which is associated with the regional center. And so please refer to our fees at the bottom of this email. Everything is laid out there for you. And please let us know how we can support you. We're glad you're here.